So what affects glomerular filtration? If this is what the body is defending, is GFR, what are the things that affect it? Well, here's our friend, the sympathetic nervous system again. The SNS has rich innervation of the kidney's vessels, including both the afferent and efferent arterioles. So when the sympathetic nervous system is strongly activated, okay, think about our shock example yesterday, right? So that would be a maximum activation. Well, when that is the case, when the SNS is in crisis mode, we will get vasoconstriction to the point of a reduced GFR, okay? In fact, we use this as a kind of sign of trouble in patients, that when a patient's urine output starts to fall, we know that they're significantly dehydrated, right? Because that's what's happening at that point. If your GFR is falling, you don't have enough fluid, your sympathetic nervous system is in crisis mode. But mild or moderate activation of the sympathetic nervous system, in other words, the things that happen to us all day long when we go from lying to standing or standing to lying, or we squat or we start a little exercise or whatever. Okay, so that level of change actually has very little effect on GFR. In other words, the kidney is doing autoregulation of some kind, right? That the sympathetic nervous system's effect on GFR is extreme in the crisis and practically non-existent the rest of the time. Well, we know the sympathetic nervous system is doing all kinds of things to change blood pressure. So there's got to be another system that's keeping GFR constant as the SNS does its thing. And that's what we're going to talk about for the rest of today, right? So mild or moderate activation has little effect on GFR. So it's usually, sympathetic system is usually just a emergency kind of a thing. So we'll circle back to that when we start talking about the juxtaglomerular system. Hormonally, systemically, in other words, humorally, as we talked about it, there are a number of molecules that do affect glomerular filtration because of their effects at the afferent and efferent arterioles. So both epi and norepi, as hormones, okay, not as neurotransmitters. As neurotransmitters, that's that mild to moderate effect, right? But a burst of adrenaline is going to tend to reduce glomerular filtration. So an endothelin, remember, is a product of endothelial cells when they're damaged, okay? And it's a potent vasoconstrictor too. So these top three are powerful vasoconstrictors. Now, angiotensin 2, is a potent vasoconstrictor. So it's surprising that the effect on GFR isn't also a decrease. And this is something that's unique to angiotensin 2. Angiotensin 2 has a big effect at the efferent arterioles, and therefore the systemic vasoconstriction that angiotensin 2 creates tends to elevate systemic blood pressure, which then actually supports increased GFR. Okay, so angiotensin 2, and if you remember, angiotensin 2 comes from the renin-angiotensin-aldosterone system. It's the kidney's own tool, right? The kidney produces renin gets angiotensin 1 gets angiotensin 2, angiotensin 2 does this, all right? So it does all fit together. So angiotensin 2 helps keep glomerular filtration up and waste products being removed, even if systemic blood pressure is having a tendency to be down, like let's say from decreased fluid status, right? So a patient's dry. They're dry, so the renin-angiotensin-aldosterone system is activated, but because of the large effect at the efferent arterioles, so if we go back and look at that, where is the efferent arterioles, right? So angiotensin 2 is going to have a potent constriction here, which is going to have a tendency to push glomerular filtration up. See? Now you don't see a big increase because remember the whole reason you are having angiotensin 2 is because your blood pressure is low to begin with. So the two are canceling each other out, right, essentially. And then we have a couple of vasodilators, right? Endothelin nitric oxide is a vasodilator, prostaglandins, and, well, nitric oxide is up there both, I guess, twice. But these are both vasodilators, and they have a tendency to increase GFR.